Thank you very much, Wendy. So I will talk quite quickly. I've tried to trim this down as much as I can to 43 slides, and I really generally struggle to try and keep things to a minimum in my lectures. As I said, today is going to be looking at multi-drug resistant infections in practice. Predominantly when we're thinking about these type of infectious, but bacterial infections, we're considering things like MRSA, so methicillin-resistant Staphylococcus aureus. There are also, I'm sure many of you are aware, are issues with multi-drug resistant Staphylococcus intermedius, so MRSI. But also, MRSP, Staphylococcus multi-drug resistant Staphylococcus pseudointermedius. But also in practice we can see lots of other multi-drug resistant infections. We certainly have had cases referred over of multi-drug resistant E. coli. We see cases of multi-drug resistant Klebsiella. So all in all, we're dealing with all these types of multi-drug resistant infections from a practice infection viewpoint in a very similar way. We're going to use slightly different antibiotics for each of those agents that they're sensitive to, but when it comes to what we do in the workplace, what we do as a clinical team dealing with these types of infections, it's all very, very similar. There's not anything we do particularly differently between the different types of infections on the whole. So we'll look through the different aspects of infection control. Really wants to be a consideration of the whole practice, and I was pleased to see actually there were a lot of vets here, and I may pick on vets slightly as we go through this webinar. So it's something that, pardon me, everyone wants to think about. Particularly nurses are going to play an instrumental role in implementing this. The reality is, in our veterinary practices, the nurses are the ones that are doing a lot of the cleaning, unless you've got auxiliary staff available. But it's making sure they're up to date, they know exactly what they should be doing in terms of these resistant infections within the clinic. And in veterinary practice, we pose very similar challenges to the human healthcare industry. They've had lots of difficulties and lots of issues with hospital-acquired infections, and we have those same issues. We also have it, maybe slightly worse, because in veterinary practice, we've got very close contact, not only between humans, between veterinary staff and us and our clients, but also between us and our patients, and also those owners and their animals as well. So all this means that is we can get transmission of infectious agents between us and animals in both directions. And what we're seeing is many of these human hospital-acquired infections we're now seeing in veterinary practice. So things like MRSA, things like MRSP are the things that they're facing a battle with, in human hospitals, and we all know that's an issue. One of the things I think is really useful to do, and this doesn't really matter what size your veterinary clinic is, but what's worth considering when we are looking to tackle infection control head-on, when we're looking to try and prevent issues with hospital-acquired infections and multi-drug resistant infections, is setting up an infection control group. Now, this may seem something that's completely over the top and something we would only maybe consider doing in a university or a referral practice setting, but actually we can create very small infection control groups within the smallest clinic. So it's really worth looking at having this dedicated group of people that are responsible for proposing policy recommendations, and this group really wants to be someone that's interested in doing that job. I don't really see any point in deciding one day that Wendy, for example, is going to be the head of our infection control group, and that's what she's going to do, if that's not what Wendy's interested in. You want to try and pick staff on that committee, on that group, where this is their interest. That's, they want to make sure they're up to date in terms of standards of hygiene, what they do within other practices, within what they do within NHS. These staff want to make sure they are on the ball, keeping an eye on what goes on with the practice in terms of cleanliness and also in terms of proper antibiotic usage as well. So it's having staff that are keen and are interested. So these staff are going to put these policies into place, they're going to make these recommendations, they're going to create SOPs, so our standard operating procedures when it comes to what antibiotics we're going to use for, orthopedics, what we're going to use for soft tissue surgeries, what we're going to do in terms of hand washing, and making sure hand washing, and we'll talk about this later on, is carried out effectively through to the clinic, and even through things like having policies in place for placing and maintaining IV and urinary catheters. So it's knowing exactly how we're going to do these things. And as I said, it's worth making sure these people are the ones that want to do that job within the clinic, because Recommendations change all the time. The way we prepare our patients is going to change. You know, certainly what I learned 20 years ago is very different from what I'm doing now. So it's having staff that are interested in that side of things. And I think if they have that enthusiasm, then they can pass that on to the team. They can enthuse, they can engage, and they can empower their whole clinical team. So that's why having the right people to do the job is what we're looking for. And these infection control practitioners, you know, the members of this group are going to be in charge of monitoring infections and also performing clinical auditing, and we'll come back to this as well. So what we're trying to avoid in this situation is infectious complications. Infectious complications are a significant contributor to morbidity and mortality. We know that, you know, things like MRSA, MRSP are not good. We don't want these infectious agents within our clinics. They're going to be hugely problematic. You know, they're going to get expensive to us. They can get expensive to the client. You know, they can result in loss of life. And also, we've got to think about the patients that are at high risk. Our critically ill, our emergency patients are at high risk of these infectious complications. They've normally, you know, are going to have some degree of immunocompromise, and they're likely to pick up these infections. And as I said, there are direct, but there are also intangible costs as well. We know that it's going to be, you know, an expensive process to have these patients in. You know, ongoing care, you know, can get expensive. These patients will have prolonged hospitalization. Those staff dealing with them are going to have to wear PPE. You know, all these effects are going to have an impact on that patient welfare and the relationship with our clients as well. So there are lots of different costs associated. And the thing is as well is that the risk factors for the development of hospital-acquired infections is often poorly understood. But we know there are certain things that we really want to be targeted, and that's why I mentioned when it came to putting together an infection control policy. So looking at how we place and how we maintain indwelling devices, particularly things like intravenous urinary catheters, how we go about prepping our patients for surgery, what we do about patients that have got prolonged hospitalised periods, particularly things like, you know, patients that are hospitalised in our ICU, how we deal with patients with severe illnesses. You know, these are the ones that we want to consider as individuals, because those are the ones that are at the high risk group of developing these hospital-acquired infections. And we know, and you know, everyone's familiar with the fact that multi-drug resistance is common in our critical patients because these are the animals that do have those catheters in, they do have those drains in, they maybe have had prolonged extensive surgeries, they are hospitalised for long periods of time. So we want to be looking for these patients and making sure we have proper protocols in place for dealing with them. And I mentioned this at the beginning, but there are lots of, you know, ways that we can transmit infections between us and the practice, between us and our patients. Our patients can pass resistant infections back to us. They can pick that up from our environment. They can pick it up from a medical environment they maybe visit. They can pick it up from their owners if their owners particularly work in healthcare environments, be them nurses, be them people that work in nursing homes, people that maybe have relatives that are in hospital. There's lots of routes that patients can pick up resistant infections from. And as I mentioned, you know, common things are common. We know patients that have indwelling devices, patients that have surgery and develop surgical site infections are common patients that are going to get resistant infections. Pneumonia is another common infection that's associated with multi-drug resistance, and urinary tract infections. And I think on the whole we can tend to be a little bit, you know, lazy maybe when it comes to, you know, if we are placing urinary catheters in patients, making sure we prep these patients properly. I talk to nurses a lot about, you know, preparing patients for surgery, and when I talk about that I ask how many nurses go and, you know, make sure they flush out prep uses as part of the preparation for doing abdominal surgery, and I would say it's probably less than 10% of nurses even consider doing that. But it's something that we want to think about. Is this something that we want to incorporate into a standard protocol of how we're going to deal with these patients, and trying to just stop those infections from becoming an issue, because that's much more easier way to tackle things than when they do develop these infections, then trying to get rid of them, which is really hard work. So we'll start by looking at biosecurity. Biosecurity are the principles, the actions, the precautions, the protocols that protect the health of our patients, protect the health of our clients, and to protect the health of our staff by trying to prevent the transmission of disease. And we're going to do that by putting physical barriers into place like our PPE, by having good hygiene practices, and these are the things that I've talked about all along. So it's looking at trying to